Sarah was 25, healthy, active, no medical history. And then one morning, she looked in the mirror and didn't recognize herself. Her lips were blue, not pale, not slightly tinted, blue. Her fingernails looked bruised. Her skin had this strange gray tone, like the color had been drained out of her overnight. She wasn't gasping for air. She wasn't choking. But something was very wrong. At the emergency room, doctors moved fast. Oxygen levels were checked immediately, 85%. Anything under 90 is a red flag. They put her on 100% oxygen. Normally, that number should climb within seconds. It didn't. The monitor stayed at 85. That's when a nurse drew her blood, and everyone in the room froze. It wasn't red. It was thick, dark, almost chocolate brown. So what makes blood red in the first place? Inside your red blood cells is hemoglobin, a protein built around iron. That iron's job is simple but vital. Grab oxygen in your lungs, deliver it to your brain, your heart, every organ that keeps you alive. When it's working properly, it's beautifully efficient. But Sarah's iron wasn't in its normal state anymore. It had been chemically changed, oxidized. Her hemoglobin had transformed into something called methemoglobin, a form that can't release oxygen the way it's supposed to. So even though she was breathing pure oxygen, her body couldn't use it. She wasn't suffocating from lack of air. She was suffocating at the molecular level. Doctors now knew what they were dealing with, methemoglobinemia. But the bigger question was why? How does a healthy 25-year-old wake up like this? They went back through everything she'd done in the last 24 hours. That's when she mentioned a bad toothache. To numb it, she'd been using an over-the-counter gel, benzocaine, again, and again, and again. Here's what most people don't know. In large amounts, benzocaine can act as an oxidizing agent. It can flip the iron in your hemoglobin into the wrong form, the form that stops delivering oxygen. She hadn't taken a poison. She'd used a drug you can buy at any pharmacy. But in high doses, it quietly rewired her blood chemistry. By the time doctors measured it, nearly half of her hemoglobin had been converted. At that level, the body starts to fail. If it keeps climbing, survival isn't guaranteed. The treatment? Ironically, it's something called methylene blue. Yes, blue. Doctors injected it into her IV. Methylene blue works by reversing the chemical mistake, donating electrons, flipping the iron back into its functional form. And within minutes, her color began to change. Her lips slowly turned pink. Her nails lost that bruised tint. Her blood, once dark and brown, returned to red. She survived, but her case is a powerful reminder of something we don't think about enough. Over-the-counter doesn't mean harmless. Our bodies run on microscopic chemical reactions, thousands of them every second. And sometimes it only takes one small imbalance, one flipped molecular switch to put your life at risk.